Today we'll be talking about stroke primarily in the Arrernte people and comparing it to the elderly Chinese population. The Arrernte people living primarily in the region of Alice Springs face a variety of health issues that require appropriate and holistic interventions. The increased frequency of many chronic conditions, including diabetes and cardiovascular disease, is one of their main problems. From 2012 to 2019, the percentage of diabetics over the age of 20 grew from 37% to 41%. Furthermore, important consequences from diabetes, including vascular problems such as hypertension, raise the risk of cardiovascular illness, making it one of the most main preventable causes of death in this population.
Moreover, mental health conditions like depression and anxiety are prevalent in the Arrernte population compared to non-Aboriginal people. Aboriginal people have twice the risk of mental and behavioral issues, particularly in youngsters, and their suicide rates are more than 3 times greater, leading to a range of future health and social problems, including substance abuse, smoking, criminal conduct, and worse educational attainment. Strong social networks, culturally competent counseling, and prompt mental health diagnosis and treatment are all effective ways to address these problems. Access to healthcare services is another essential need for good health. The Arrernte people living in the surrounding areas around Alice Springs may have to travel hundreds of kilometers to get to the closest emergency and specialized medical care facility, Alice Springs Hospital. Due to the lack of continuity of care, which results in worse health outcomes, this is particularly detrimental to moms who need parental care and babies. However, the obstacle can be reduced to increase access for the Arrernte people by efficient coordination and communication amongst healthcare providers within these locations.
These are just some of the broader health issues that lead the Arrernte people to poorer health outcomes and lower life expectancies. But today we'll be specifically looking at the high risks of stroke. The most potent risk factors for stroke include hypertension, diabetes, smoking, and hyperlipidemia. Due to their lifestyle factors and various health requirements, the Arrernte people have a higher prevalence of smoking, diabetes, and dyslipidemia, often leading to them suffering strokes at a younger age compared to non-Indigenous people. These factors are comparable to the elderly Chinese population group, who have a higher prevalence of diabetes compared to those non-Chinese Australians. Effective stroke prevention requires consistent screening and management of conditions such as diabetes and hypertension.
Prevalence of non-communicable diseases involves a combination of factors such as lifestyle choices, genetic, and environmental factors. In terms of diabetes, it has been identified that comorbidities such as hypertension, alcohol misuse, and vitamin deficiencies complicate the prevalence of diabetes. Studies have identified obesity as one of the main reasons for hypertension amongst Indigenous population. Studies have also identified that there is also an increased risk of hypertension during pregnancy among young women. Respiratory infections such as bronchitis and pneumonia are common among Indigenous children and remote communities such as in Alice Springs, and the main factor have been identified as poverty, overcrowded housing, and limited access to healthcare. Social determinants that influence health needs can be identified as a high rates of unemployment, low income, as well as lower level of education, which contribute to the health literacy, impacting their ability to navigate the healthcare system and make informed decisions about their health.
In addition to these risk factors, disruption due to colonization, loss of land, and culture has been a long-term impact on the health and well-being of the population. The historical trauma of colonization has continued to affect the mental health of the current generations. Reasons for healthcare needs are also a result of the environmental factors such as remote location, where areas such as Alice Springs can limit access to healthcare facilities. Cassandra will further elaborate on this.
A commonly seen barrier for the Arrernte people and the Aboriginal people in Australia is the lack of access to healthcare with inconsistency, lack of services, and lower infrastructure standards that are often seen in remote regions. As seen in this image, it displays an extensive group of Indigenous Australians developed by David R. Horton in 1996. Within the Northern Territory, Aboriginals are a large part of the health group, with 70% of hospital users being Indigenous. According to the Australian Bureau of Statistics, stroke accounted for 1% of long-term health conditions. Within Central Alice Springs, there are approximately 10 medical centers, such as the Lara Pinta Clinic and the Alakura Women's Health Clinic, and 3 physiotherapy centers. However, as you exit the Central Alice Springs city region, there's a lack of access to health services for people in rural areas of the suburbs. Thus, despite the lack of access in outer regions, there has shown a growing demand and display for importance on providing a range of healthcare services for Indigenous people in rural and remote regions. However, there are concerns on health professionals and their understanding of cultural protocols that often have extensive differences, such as avoiding eye contact, respectful communication, or sorry business. These are all cultural practices that are of utmost importance that require an understanding between the specialist and their patients. These are all substantial impacts on the Arrernte people when accessing health services that can be the indicator of leading into a growing stroke rate for the Arrernte people along with their aging population. Monique will be discussing the similarities and differences between our 2 chosen groups.
Arrernte people and elderly Chinese Australians face similar challenges when accessing healthcare, particularly due to language barriers and significance of community connections. Language barriers impede receiving optimal care for both groups, particularly impacting elderly Chinese Australians as they are unable to navigate the healthcare system, resulting in lowered health outcomes unless they depend on their children. Similarly, the 5 different dialects of Arrernte is spoken by 1,800 people. Which creates communication barriers, which in turn contributes to the Arrernte people feeling unsupported and lower healthcare utilization rates. Additionally, both groups value the importance of community connections in enhancing health and well-being. For Arrernte people, connection to community fosters resilience and emotional well-being, which mirrors the significance of neighbourhood cohesion, social support, and social networks for the elderly Chinese Australians. A major difference between the health experiences of Arrernte people and elderly Chinese Australians is the connection to land to promote health and well-being. Arrernte health is holistic as it encompasses mental health and physical, cultural, and spiritual health, with land being central to their well-being. This connection to country is linked to maintaining identity, individual autonomy, and Indigenous sovereignty. A clear example of connection to country improving an individual's health and well-being is through the Indigenous land management, which involves employment of Arrernte people to manage lands using both customary and modern techniques. It has been reported that individuals who were involved in the Indigenous land management had increased physical activity, better diet, and lower body weight, blood pressure, blood sugar, and cholesterol, and therefore better overall health and well-being. We'll now just talk about what clinical skills each profession needs when addressing the needs of these health groups.
Occupational therapists assist people to engage in activities that they're required to do, want to do, or need to do. This might be by adjusting or modifying the person, the activity, or the environment in order to support participation. Our clinical skills include reflective practice, assessment skills, activity analysis, client-centered goal setting, therapeutic use of self, problem solving, and report writing. By using these skills, we're able to effectively assess, analyze, and problem solve with our client to support their participation in those activities they need to do, want to do, or required to participate in.
Physiotherapists are health specialists that focus on the human body and the articulation and movements. Stroke patients often go to a physiotherapist for rehabilitation on mobility recovery, as after a patient is affected by a stroke, they commonly lack the ability to do controlled movements or have weaknesses on their arms and legs. This is due to the brain not processing and talking to the muscle to create those movements. Thus, with exercises and consistent stage goals to be checked throughout their consultations, it supports the brain to create a connection and pathway with these movements that was commonly done prior to a patient having a stroke.
According to a study from Gorse in 2015, about 60 to 80% stroke survivors are able to walk independently. Many have reduced balance, weaker muscles, high risk of falls, and altered gait cycle. This is where podiatrists play a crucial role in helping patients that undergo stroke and have manifold complications. Post-stroke, elderly patients are likely to have foot deformity, reduced foot range of motion, altered gait cycle, and reduced joint strength. Podiatrists can assess the gait cycle and address issues that could increase the patient's risk of falls through recommending appropriate footwear, custom orthotics to accommodate to their foot deformity, and strengthening exercises to strengthen the weak muscles and increase the range of motion in the foot. Also providing preventative care for patients through regular general nail and skin care and monitoring vascular and neurological status to minimize the risk of developing further complications.
The clinical skills required by paramedics to meet the needs of Arrernte people predominantly lie in their communication skills and their cultural awareness. When communicating with people from the Arrernte country, it is imperative to communicate openly with the patient in an informal and softly spoken manner, as the direct and confident professional manner may be perceived as offensive. This communication style encourages the development of rapport, trust, and respect between the patient and the paramedic, as it aids in the reduction of the power imbalance between the two parties. Furthermore, exploring the patient's cultural background and establishing the local community elder and the correct person to include in clinical decision-making allows for holistic care to be provided, as the patient has a strong support system in place when their medical emergency is occurring. In order to ensure cultural safety, it is essential that the effects of colonization and systemic racism are acknowledged. This encourages a safe environment where personal biases and stereotypes are confronted.
Also, when attending a case presenting with stroke-like symptoms, paramedics can utilize several assessment tools to assess the nature of the stroke. These tools include the FAST assessment, the Hunter-8 stroke score, and the pre-morbid modified ranking scale, which can identify and predict the potential risk and the severity of the stroke.
Cardiovascular disease is the leading cause of death and disability in Indigenous communities, with stroke incidence notably higher among the Indigenous Australians compared to non-Indigenous Australians. 2.6 times higher in men and 3 times higher in women. Managing risk factors like physical inactivity, obesity, diabetes, high blood pressure, and tobacco smoking, which are more prevalent among Indigenous Australians, is crucial for stroke prevention. In 2004 and 2005, the National Aboriginal and Torres Strait Islander Health Survey reported that 75% of Indigenous people had sedentary or low levels of physical activity, a significant risk factor for cardiovascular disease and specifically stroke. Promoting physical activity through culturally relevant methods, such as traditional dance and music, which are integral parts of the Aboriginal culture, can improve stroke outcomes. Our proposal is an annual dance day and a competition organised by the allied health professionals to educate the community about stroke risk factors and promote physical activity. A similar initiative has been completed in Western Australia, successfully increased physical activity through diet and physical activity interventions. During the event, the paramedics will educate attendees on stroke signs and symptoms, emphasising the importance of physical activity. They'll also offer free blood pressure testing and glucose testing. Podiatrists will advise on suitable footwear to minimise injury, while occupational therapists will ensure the event is accessible to all, regardless of age, skill, or physical ability. Physiotherapists will provide manual therapy techniques such as massage and stretching to reduce pain and improve mobility. Addressing barriers to physical activity, cultural, geographical, and socioeconomic is essential. Cultural barriers include perceptions of health and time concepts, while geographical barriers include location, environment, and climate. Socioeconomic barriers encompass resources, accessibility, and costs. To mitigate these, the dance day will be free, with transportation provided to ensure accessibility for all community members. Collaborating with the community leaders and elders will ensure cultural sensitivity and family inclusion. The event aims to enhance the physical, mental, and emotional and spiritual well-being. Physically, it can improve cardiovascular fitness, muscle strength, and flexibility. Mental and emotionally, dance can reduce stress, enhance mood, and boost self-esteem. Spiritually, engaging in traditional practices fosters a sense of purpose and belonging. Traditional dance often involves multiple generations, helping to pass down cultural knowledge and traditions while promoting physical activity across all ages. Elders will serve as role models, encouraging the younger generations to stay active and connected to their heritage. A similar festival in northern Queensland has successfully showcased Aboriginal culture and attracted thousands of visitors annually, promoting physical activity through 3 days of song and dance. And our strategy aims to engage the entire community also and demonstrate how dance and movement can reduce a major stroke risk factor. Several adjustments can be made in this strategy in order to include culturally and linguistically diverse groups such as the elderly Chinese. Educational material can be created in multiple languages in order including visual aids and simple language to ensure the content is easily readable and understood. Interpreters in the form of family members or hired assistants will be engaged to assist on the dance day. Demonstrations and interactive sessions such as those presented by the physiotherapist will be presented in smaller groups with visual aids and cues to explain key concepts in order to assist with understanding. Additionally, we'd like to engage the community leaders to convey the correct messaging and in a culturally sensitive and appropriate manner. Finally, we'd like to create material that can be taken home and used outside of the dance day to promote continuity of engagement such as printed flyers and visual aids. The following slides are our references.